Welcome back to a session on outbreak management. This session will focus on environmental cleaning practices. My name is Erin, and I'm from IPAC Consulting, where we specialize in consulting long-term care homes to aid in ministry compliance, outbreak management, and staff training. Healthcare settings are complex environments where the provision of care to large numbers of residents results in the contamination of services and equipment with harmful microorganisms. Contaminated surfaces and equipment contribute to the transmission of microorganisms and to the burden of healthcare-associated infections. Routine and effective cleaning and disinfection of services, items, and equipment is an essential activity that protects residents, staff, and visitors from infection. Because of the increased risks and consequences of infection transmission in this setting, the approach and intensity of cleaning required differs from that of non-healthcare settings. In the first section of this best practice document, we present the evidence supporting the role of environmental cleaning in preventing infection and describe the principles of safe and effective environmental cleaning in the healthcare setting. There has been expansion in the evidence demonstrating that effective cleaning and disinfection reduces this risk of infection. From a theoretical perspective, all of the following steps are required for environmental contamination to result in infection. Effective environmental cleaning will disrupt direct resident-to-surface to resident transmission of microorganisms and minimize, along with effective hand hygiene, surface to healthcare to resident transmission. The healthcare environment is frequently contaminated with microorganisms, including clinically important bacteria, viruses, and fungi. Contamination of most frequently touched surfaces and items within the resident and/or healthcare environment has been documented. Additionally, viable microorganisms can persist on surfaces and items for prolonged periods of time, particularly for organisms such as C. difficile, vancomycin-resistant enterococci, or VRE, or MRSA. Contamination of healthcare providers' hands or gloves occurs frequently following contact with environmental surfaces in patient rooms. Healthcare providers that come in contact with surfaces in the room of a patient colonized with MRSA or VRE have a 42 to 52% risk of subsequent hand or glove contamination with the same organism. This risk is similar to the risk seen in following direct contact with the patient. After contact with a VRE contaminated surface, healthcare providers transmit VRE to the next clean surface or skin site they come in contact with approximately 10% of the time. How does environmental contamination cause infection, you might ask? To start the whole process, the environment becomes contaminated with microorganisms. Once the environment becomes contaminated, the microorganisms will survive for a sufficient duration to allow transmission. Residents will either acquire the microorganisms through direct contact with the environment or the hands or gloves of healthcare providers or equipment that becomes contaminated through direct contact with the environment and then transmit the microorganism to another resident due to lapse in hand hygiene and/or disinfection of shared equipment. And finally, acquisition of a microorganism that results in infection. Healthcare settings should have policies that include the criteria to be used when choosing surfaces, finishes, furnishings, and equipment for resident care areas. These policies should ensure that all surfaces, finishes, furnishings, and equipment meet infection prevention and control requirements for cleaning and disinfection. Some characteristics to consider that will minimize the risk of microbial contamination are that furnishings, surfaces, finishes, and equipment shall be cleanable and able to withstand repeated cleaning and to be compatible with hospital detergents, cleaners, and disinfectants. Cleaning is the removal of foreign material, for example, dust, soil, organic material such as blood, secretions, excretions, and microorganisms from a surface or an object. Cleaning physically removes rather than kills microorganisms, reducing the organism load on a surface. It is accomplished with water, detergents, and mechanical action. The key to cleaning is the use of friction to remove microorganisms and debris. Thorough cleaning is required for any equipment or device to be disinfected, as organic material may inactivate the disinfectant. This may be accomplished through a two-step process involving the use of a cleaner followed by a disinfectant, or through a one-step process using a combined cleaner or disinfectant product. Disinfection is a process used on inanimate objects and surfaces to kill microorganisms. Disinfection will kill most disease-causing microorganisms, but may not kill all bacterial spores. The key to cleaning is the use of friction to remove microorganisms and debris. Environmental service workers work in a healthcare environment where there are risks of infectious diseases through transmission exposure to residents, contaminated items and surfaces, and via exposure to blood and bodily fluids. These risks can be minimized by the correct and consistent use of good infection prevention and control practices, most importantly, the use of routine practices at all times when in the care environment. All healthcare settings should have clearly defined cleaning policies and procedures that are reviewed and updated on a regular basis. Environmental cleaning must aim to reduce or eliminate microbial contamination within the environment. A healthcare clean should result in the elimination of or a significant reduction in microbial contamination of all surfaces and items within the environment, in addition to providing a visually clean environment. This requires, in addition to the performance of a hotel clean, an increased frequency and thoroughness of cleaning, as well as the use of disinfectants. The healthcare component of a healthcare facility includes all areas involved in resident care, including all resident wards or units, and including nursing stations, procedure rooms, clinic and examination rooms, diagnostic and treatment areas, and washrooms. Additional cleaning practices are practices that go beyond those routinely required. Additional cleaning practices may be required for residents known or suspected to be colonized or infected with an infected organism. Enhanced cleaning and disinfection is often required during outbreaks of organisms when environmental contamination and subsequent transmission is known to be related to the type of organism suspected of causing the outbreak. Although any surface may become contaminated, the risk and extent of contamination is greater for surfaces and items that are handled frequently by the hands or gloves of staff or residents as compared to surfaces that are handled less frequently or touched. Although any surface may become contaminated, the risk and extent of contamination is greater for surfaces and items that are handled frequently by the hands or gloves of staff or residents as compared to surfaces that are less frequently handled or touched. Thus, surfaces within the healthcare setting, and in particular within the resident's environment, can be classified as high and low touch surfaces as follows. High touch surfaces are those that have frequent contact with hands. Cleaning and disinfecting should be performed at least twice a day and more frequently if the risk of environmental contamination is higher. Low touch surfaces are those that have minimal contact with hands and only require cleaning once a day, every other day, or whenever visibly soiled. You must know the difference between a soiled utility room and a clean utility room, and the cleaning that is required for each type of room. A soiled utility room must be physically separate from other areas. There should be a work counter and flushing rim clinical sink or hopper. You should have a dedicated sink that is only meant for hand washing, that is separate from other sinks. You should have an adequate space to permit the use of equipment for the disposal of waste. You should always have personal protective equipment available that should be adequately sized and located near the point of care. A clean utility room must be separate from and have no direct connection with any soiled rooms. You must keep all supplies free from dust and moisture, and they all must be stored off of the floor. The clean utility room should be adjacent to usage areas and easily available to staff, and it should be equipped with a work counter and dedicated hand washing sink. Serious outbreaks have been due to the transmission of microorganisms associated with inappropriate management of soiled linen. That is why it is so important to know how to properly manage and store soiled linens. All soiled linen that is soiled with blood, body fluids, secretions, excretions should be handled using these routine precautions. Use gloves and appropriate PPE, contain soiled laundry at the point of care, handle with minimum agitation to avoid contamination, linen bags shall be tied securely and not be overfilled, and containers for collecting, storing, or transporting soiled linens should be waterproof, leak-proof, and non-porous. Knowing the sequence of cleaning is very imperative when it comes to completing the cleaning process correctly. When you are cleaning, you move from clean to dirty and from high touch to low touch. The steps that should be followed to ensure you complete this correct are: first, conduct a risk assessment. 2, assemble the cleaning supplies. Next, perform hand hygiene and donning of PPE if required. Next, use fresh cloths for cleaning each resident bed space and area of the room. Please note that you do not double dip a cloth if the bucket is used, and you do not shake out the cloth. Perform high-touch surface cleaning of the entire room. This includes cleaning doors, door handles, bed rails, or call bells. Then perform low-touch surface cleaning of the entire room, which includes walls, picture frames, windowsills, or television. Next, you clean the bathroom. And finally, mop the living space, change the mop head, mop the bathroom, change the mop head again, and finish with mopping the exit/entrance of the room. It has been great to work with long-term care homes, and it's been an honor to be partnered with the OLTCA to provide this education. For more information, please visit IPACconsulting.com. We'd be happy to assist you.